Welcome everyone. We have everyone trickling in. As Analia would say, good morning, good afternoon, good evening, depending on where you are in the world. If you don't mind, we always enjoy it when individuals put where they are joining us from in the chat function. We're delighted to host you today for our webinar, When Our Performance Depends on It. Strategies and scripts for addressing interpreter mental fatigue. My name is John Arroyave. I'm director of CCC. And also with us today behind the scenes is actually Zach Williams, cross-cultural communications manager of e-learning. We're super excited because Andrea Henry is presenting today. I'm going to get into a little bit about her bio in just a little bit, but before we begin, and as we wait for everyone to come online, I'd like to quickly share some CCC updates on the website. So we have in August, we have Marisa Rueda, What Happened to You? Healing After Vicarious Trauma. We're going to put a link to that in the chat. That is in August. And then in September, we have the Interpreter's Toolkit, Concrete Strategies for Improving Ethical Decisions, Reflective Practice, and Session Management. So that's in September. Also, we have the TOT in November that consistently fills up a couple months in advance. That is also on the website. Just a few quick points before we get into the webinar. Presentation is going to last about 45 minutes. You do need to be here for the full hour to get your CEUs. We're going to have about 15 minutes of Q&A. And then for any questions, please put them in the chat. This webinar, as mentioned, was approved for CEUs. It does take us about 24 hours to email everyone their certificate. So without further ado, I want to begin our presentation. So Andrea Henry is presenting today. I was super excited when we found out Andrea Henry would be presenting a webinar. I think I saw Andrea Henry's keynote at the CATI annual conference in May in North Carolina. And I was really struck by just the depth and the breadth of her knowledge and her expertise. She's someone who has been in this profession for a long time, who has done everything, really from OPI to on-site face-to-face interpreting at a level 1 trauma center, who's trained interpreters, who's coordinated interpreters. I really think she really combines a deep love for the profession and for the craft of interpreting with an ability to communicate kind of the intangibles of what we do as interpreters to those that are outside of our profession and outside of language access. She is, just to read a little bit about her bio, she is dedicated to moving our field forward by sharing strategies that improve communication and the patient's clinical outcome, as well as our perceived value. She is strongly invested in keeping interpreters on the front lines by raising awareness of our skill, improving working conditions, and addressing the issue of fair pay. Super important. Andrea is also principal investigator on a grant-funded research project for the development and validation of a tool that measures complexity and mental fatigue during healthcare encounters. She's also a CCHI commissioner. And so Andrea that was a little bit about Andrea, and she can go ahead and join us when she's ready. But she will be the expert on Andrea, and just want to take a look at. So we have hello from Milwaukee. I saw Córdoba, Argentina. I saw a bunch of different areas. There she is, Milwaukee, Georgia. Let's see, what else do we have? The UK. So fantastic. So excellent. Wonderful. Thank you so much for joining us, Andrea. I will turn it over to you.
Thank you, John. I really appreciate that introduction.
Absolutely.
Yeah, and thank you everyone for being here. So this webinar is not about burnout. It's not about self-care. this is about asking for what we need. This is about us protecting our performance by advocating for ourselves and for better working conditions.
Excellent.
So you've already read the learning objectives. I'll just go through them quickly. One of them is to learn about the Joint Commission Speak Up initiative and how it aligns with interpreters advocating for better working conditions. Our second learning objective is to acquire specific strategies that reduce interpreter mental fatigue and improve our performance and create greater awareness about the mental demands and the complexity of healthcare interpreting. And the third one is to explore modes of interpreting, consecutive, simultaneous, or consecutive and simultaneous combined, and the equipment that may help reduce interpreter mental fatigue in certain encounters and improve our performance. And just a disclaimer, I do work, like John mentioned, in a level 1 pediatric healthcare center. It's a hospital with inpatient and outpatient, but I mostly work with moms and dads, which means that when I give examples, I talk a lot about interpreting for moms and dads. I don't often interpret for the patient, though occasionally we do. In fact, this year, more than ever, we are interpreting for more recently arrived children and young adults that are not fluent yet in English because they've just come over to the States. But my examples generally do involve talking about caregivers for patients. So I hope that's helpful. I do believe that Alice Walker hit it on the nail when she said most people, or the most common way people give up their power is by thinking that they don't have any. I think that this is really applicable to us as interpreters. Sometimes we confuse neutrality and impartiality with not having a voice. And I believe we do have a voice and must exercise it for the sake of the patients. So this presentation is very much about that and having more agency and more of a voice in the encounter. And just to lay the groundwork, these strategies that I'm going to share are in alignment with our various codes of ethics. I've shared a few, the National Council's, National Council of Interpreting Healthcare's Code of Ethics and Standards of Practice, the IMIA, and the Registry of Interpreters for the Deaf. They are in alignment with these codes of ethics, the strategies, and that is to say that they don't interfere with our code of conduct. In fact, the level of agency that I'm encouraging, actually, I believe allows us to better adhere to our ethical goal to be accurate and complete in our renditions and to interpret in an effective way that captures the meaning and the intention behind the speaker's words. And just a few supplemental paradigms. The main one that I wanted to talk about was the Joint Commission Speak Up campaign. That's a key paradigm that informs on our code of ethics and our standards of practice. And it's a campaign in healthcare that the Joint Commission started. It was designed to help patients and their families to become more active in their care and not passive for the sake of equal outcomes and patient safety, for the sake of preventing medical errors. And much like their goal, we as interpreters have the right and the responsibility to take action for the sake of optimal or best working conditions. And I argue that we need to speak up for our performance, because if our performance is degraded in any way by the working conditions that we deal with, that can impact the communication and the success of the encounter. And that can impact patient safety. So I argue that we must do what we can to prevent our own errors in our performance. And I believe this campaign by the Joint Commission aligns really well with our ethical goals. And I believe we should apply it to our work. After all, if we don't speak up for ourselves, who will? And conversely, if we speak up for ourselves, then others might start to really understand and better advocate for our working conditions. And just to get started on the concept of scripts, one of the scripts that I would recommend that I use before interpreting, maybe even in your process of getting new assignments, whether or not you're a freelancer or a staff interpreter, but one script is to say, as a professional charged with being your voice, I'm responsible for ensuring that my interpreting performance is excellent or optimal. Thank you for collaborating with me. That's one script. Another script might be, before we get started, I just want you to know that my request will help me ensure optimal or excellent performance. You can choose whichever adjective you want. And thank you for partnering with me. And here's a few more paradigms and frameworks that inform on our code of ethics. Oh, sorry. And I have a reference list at the end that include all of these if they're unfamiliar to you, and I'm very happy to share them with you. So you can certainly reach out to me or to CCC. But normative ethics, I would have to thank Dr. Robin Dean for talking a lot about that in her presentations and in her literature, as well as interpreter as practice profession. Normative ethics in a really brief way to explain it, basically advocates for the concept of looking at context and consequences when you're making your decisions. And then interpreters incremental interventionists, thank you, Cindy wrote. That's in a white paper by the NCIHC, and Cindy wrote, I very much am in support of it, and role space theory, which incidentally, a lot of the strategies that I'm talking about today involve presentation of self, or essentially speaking in your own voice. So it's another bit of meta language that you could use when you're thinking about what you're doing when you're speaking on your own behalf. Again, those references and links to them are at the end in a reference list. And some important considerations before we use these strategies are to consider our manager's expectations when applying these strategies. We need to consider stakeholders' expectations as well. Stakeholders being the patient, the caregiver, providers, nurses. If you're in the education environment, or you're interpreting in an educational setting, that would be maybe stakeholders might be the students, the parents, other members of the family, administrators, teachers. But we need to take into consideration what their expectations are of us, and have that inform on our practice, and also the amount of rapport that you have with them. Because the more rapport that you have, and the more you've maybe gotten familiar with certain people or certain parties, the easier it is for you to use these strategies. But some of the strategies will require more negotiation or less, depending on the environment and the players. And they will be, I believe, easier for those of us who have the support of our managers. And I'm happy to share that my management at Children's Healthcare of Atlanta are very much in support of us protecting our performance. But I'm regularly in dialogue with them, and we do discuss these things just as part of our normal day-to-day work. But it is easier for those of us who have that. It's easier, certainly, for staff interpreters in an area where they know people, have partnered with them regularly, and therefore have rapport. And it'll probably be easier for face-to-face. So if you're a remote interpreter, you know, one of our colleagues doing OPI or VRI, it may be harder, but I would argue that you still should ask, all of us, regardless of how hard the environment is for us. The more we ask, I believe, the more we will get closer to getting better working environments. So speak up, like the Joint Commission recommends. Don't stay quiet. Even if you don't get what you need, I still recommend we try everything we can to do it, because the patients, the caregivers, the students, any community setting that you're in, they deserve nothing less than that. And again, just as a reminder, these strategies are about reducing acute mental fatigue in the encounter to improve our performance. They're not about burnout or long-term fatigue. So if your brain is a gas tank, how do you conserve as much brain fuel as possible for the actual work of interpreting? Interpreting in healthcare can be very exhausting. I'm assuming in education it can be too. That is an area I'm unfamiliar with, but I know we have a lot of similarities. A lot of it's unpredictable, and it's dialogue. People can be quite unpredictable in the things that they say, and they can be quite messy. I certainly can when I'm just talking. I'm no better than any of the providers that I work with who talk and talk and talk and don't stop. So it's something we have to take into consideration, but it can be very exhausting. So how do we maintain our brain fuel? Ideally, we should preserve as much as the energy that we have from a cerebral standpoint as we can, and especially in our frontal lobes. So we use our prefrontal cortex for decision-making and working memory. Those are vital for the interpreter's performance. And something to keep in mind is that the demands on concentration when you're interpreting, in dialogue interpreting, and the distractions and the potential stressors will steal from your frontal lobes. And essentially, in plain language, that would be basically emptying your gas tank. And that could degrade your performance. So it's something really to think about just in terms of the environment we're in. It is a very unpredictable and potentially very exhausting environment, depending on the encounter, the players, and different characteristics. So at Children's Healthcare of Atlanta, like John had mentioned, we've worked on research with Emory University on a tool to measure mental fatigue in the encounter. Again, not chronic fatigue or burnout, but one of our statisticians, Dr. Courtney McCracken, did a search of the literature and found 3 things that contribute to mental fatigue in general. But these 3 things are incidentally very relevant to the work of interpreting. Interpreting involves, and I know you know this, so I'm preaching to the choir, but it involves a certain amount of hypervigilance or an excessive vigilance of what's being said. So one of the things that contributes to mental fatigue that Dr. McCracken found was continual mental effort without a break. Sounds a lot like interpreting. Excessive attention on a particular task. Sounds a lot like interpreting. So both of these contribute to mental fatigue. And high levels of stress or emotion, which is very much the case in many of the encounters that some of us work in. And it doesn't necessarily have to be a hospital. It doesn't necessarily have to be the ICU. Most things related to somebody's health, and you could argue education can be quite stressful. Bad news can cause quite a bit of stress for everybody involved, in addition to just about every other kind of dialogue that could be occurring in that environment. So these strategies come from my 28 years in the field and from interpreters, colleagues of mine across the country and here in Atlanta, my colleagues, my team, who've engaged me on these issues. And this quote really is perfectly applicable. People closest to the problem are closest to the solution, but they're often furthest from the power to change anything or the resources. That is the truth with most things, but I do want to encourage and I do want to argue with this webinar that we have quite a bit of power and agency to make some solutions or to find ways to improve our working conditions on our own, in addition to the other things that our management does for us. So where we're going at this point now is I'm going to talk about strategies to use before, during, and after the interpreter-mediated interaction, which is just some jargon, but it allows me to use an acronym, which allows me to keep my slides sort of minimal, to also maybe hopefully reduce your mental fatigue staring at the slides and listening to me. But IMI is one acronym that's in the literature to refer to what we do in these environments. IMHE is also another acronym. So to start, I want to talk about what to do beforehand, before you start an assignment. And I believe that deliberate perspective taking is key for reducing mental fatigue. So to explain, we spend a lot of time being frustrated by non-compliant parties who don't pause or take turns, and that frustration can be fatiguing. So this first strategy is not just for interpreters, but managers and trainers. I argue that we should include the opportunity to be interpreted and see what it's like as part of interpreter training or interpreter onboarding. If we teach interpreters to experience what it's like to be on the other side, to actually have someone interpret for us, we could potentially reduce a certain percentage of stress-related mental fatigue, which should be able to help us keep that mental gas tank full or fuller so that we can perform well. And, you know, if we learn in our training, for example, how difficult it is to be interpreted to stop every time we're talking and then start, stop, to have your thoughts chopped up into chunks and to not be able to speak naturally while you're being interpreted, I believe we would have more empathy for others. I certainly do myself. I have been interpreted, and this is where this comes from, is me realizing, my God, it's not that easy to be interpreted. But I do believe that empathy or having an understanding of what it's like could reduce a certain amount of fatigue and keep some of that gas in your gas tank. The second strategy to do before the IMI or before the interpreter-mediated interaction is to know yourself. Know what you like, know the areas in your field that you understand well, know the areas that you're good at. In healthcare, there's roughly 60 possible specialties. There's a lot that I'm good at. There's a lot that I'm not good at. There's a lot that I love, and there's a lot that I absolutely do not want to go and interpret for. And it does help. By that same token, if you know those things, you can certainly, if you have the opportunity, especially as a freelancer, to avoid certain specialties in order to prevent unnecessary stress or mental fatigue. You can certainly do that in a hospital setting. We don't necessarily have the option to turn things down, but we do know when an area is going to be difficult for us. And if you know in advance, you might be able to say, okay, this is not my favorite area, or these are not my favorite players. They're difficult, they're demanding, it's going to be tough. But knowing that in advance will allow you to use some additional interventions. And with more self-awareness, you'll get skilled at choosing assignments or declining them, or better negotiating aspects of those assignments in your favor due to the environment or the other characteristics of it. And then the third one is acute PE. It's another acronym in the literature, but it's really just a short burst of exercise. Short bursts of exercise, something as short as 3 to 5 minutes, depending on your level of mobility. I have some issues with my mobility, but I can do quite a bit from my waist down. I have an arm issue, but depending on your mobility, according to the research, if you do 3 to 5 minutes of a burst of exercise, even going to the bathroom and doing jumping jacks, if that is your level of mobility, can be very beneficial to your cognition. It has been shown in research, even a short burst, to improve cognition and short-term memory. Those are the things we absolutely need in interpreting. And then if you look at it from the standpoint of being prepared, like if I get a care conference, maybe the dispatcher says, listen, Andrea, at 2, there's a big care conference for the kiddo in the ICU, and it's going to be a tough one. If I've got a few minutes, I'll say, can I run to the gym and just get on the bike or the elliptical just for a few minutes? And if I've got the time, I will go and do that. And know it sounds crazy. Maybe it doesn't. I don't know. It sounded crazy to me initially, but it really does improve my cognition. It makes me feel just like I can anticipate the stress, and maybe it won't take so much from my gas tank. And then here's the next few pre-IMI strategies, or before you start interpreting. Content refers to, like, for example, when we do conference interpreting, we often get written materials for the speech ahead of time, and that allows for study and preparation and being able to predict what's going to be said. It's unlikely that we'll be offered any materials for long unilateral, say, like teaching sessions or for IEP meetings in the education environment. They may not offer it, but I argue that we should continue to assertively ask for them. And here's a script that you could use. You could say, listen, hey, I do look forward to interpreting for this 3-hour teaching for a small bowel transplant. Maybe you're typing this out as part of accepting an assignment, but I'd appreciate any written materials, anything that would help me do a more quality interpretation by allowing me to study this in advance, not just the words, but potentially the way somebody's going to use those words. And then thank you. That is one way to prepare. In a medical environment, another way to know the content before you go in that room, and this is something that I regularly do, I ask the provider before I go in the room, can you please tell me what your goal is for the communication? That enables me to predict where the trajectory is supposed to go. And I'll that's one of my scripts as well. I'll say, thank you. Knowing your goal allows me to be able to predict what this interpretation is going to be like, and I'll do a better job. It'll improve my performance. And then also asking the provider or the group. I work in a teaching facility, and all of us interpreters work with a wide variety of doctors. And every July, right now, we get new residents, and we've got about 30 new providers, in addition to the 2,000 providers that Children's Healthcare of Atlanta has, or more than 2,000. And so we're working with new people, new names, and to write down their names before I walk in the room, because they're going to introduce themselves. There might be 5 of them all introducing themselves, and some of them are like low talkers, you can barely hear them. Some of them, they have a very unusual last name, something I'm not familiar with. So I say, before we go in the room, let me write down your names really quick so that when you introduce yourself, I can do it better without asking you to repeat. It'll improve my ability to do a good job even with your names. I do the same thing with medications. A script might be, listen, before we go in the room, is there anything I should know about a new diagnosis, a name that I should be familiar with? Or are we going to be talking about any medications so that I'm not going to interrupt you as much? It will help my performance. And they might say, oh yeah, we're going to be talking about Neupogen or Epogen or etoposide, or maybe Jakafi or Benofidir. I don't even know if I said that right. That one's a hard one. Renodifir. I don't know if anyone knows that. I think that's an immunotherapy. Rituximab, Lovenox, Ganocyclovir, tacrolimus, Celsep, Valsite, anything. All of those would be really tough for me to say in the moment, especially if it's a list. So to write them down in advance can help you tremendously with your performance and reduce some of the fatigue that comes with those moments where you didn't hear correctly. You have to ask for repetition. And I've had it happen where the medication name was so unusual to me that I had to ask them to repeat it multiple times throughout an encounter, and it really did impact my performance, in addition to just being quite stressful and exhausting, which is just like this vicious cycle. And then let's see, setting your stage. Okay, so if you set your stage, that's basically you saying, okay, before we get started, these are the things that I need. So if you're aware that it's going to be a long interaction or a series of interactions, like a transplant evaluation for us could be a full day or 2 days of a multitude of providers coming in and talking to the parents, you can set the stage by saying, listen, this is going to be long and I want to do my best with my performance. I'm going to be taking a break on the hour every hour. And that follows the Pomodoro method, by the way. For any of you who are aware of the Pomodoro method, it's a evidence-based practice, or it's a research proven practice that shows that 5 minutes of a break every 25 minutes or 10 minutes every 50 of focused work. If you get that 5 minutes or the 10 minutes, 5 at 25 minutes and then 10 minutes after 50 minutes of focused work, you can, if you take a break, you can refill your gas tank to an extent. So it's a proven method. And so I argue that we can very comfortably ask for that and let them know I'm going to be needing that, or I'm going to need to take bathroom breaks. Anything to prepare them for what you're going to need to do if you don't have team interpreting. And then, sorry, number 3, with traffic signals, sorry, my minutes are a little funny. Also with managers, just for setting the stage, I did want to say that our management is wonderful at this, but I would suggest that other managers across the country and trainers advocate for this whenever they get a chance to talk to other stakeholders and leaders, and to say, please allow my team to advocate for themselves. Please allow my interpreters to ask for what they need. And to explain in another script, interpreters require hypervigilance to words, concepts, and the intention behind words. Managers can encourage this just by sharing it with others. And they can say, other scripts like, my interpreters will need to periodically pause to the interpretation and step out of the room to take a restroom break, or whatever it is they need to make sure they're performing at their best. And that goes a long way to helping people understand how complex this work is. And then traffic signals is really that idea. I'm a hand raiser. I don't know if anyone else is, but I generally let them know, listen, my hand will go up. I tell the parents this too. My hand will go up every time I need to clarify something, and that's so that I can interpret really well. So that is my way of letting people know why I'm doing these things. But with traffic signals, you can also use signs. I know Jennifer Santiagos, if anyone knows her, she presents quite a bit on interpreters advocating for themselves in addition to other subjects, but she's in California. She has a sign that she created for the same concept, to essentially get that pause when you need it and prepare them in advance. I'll either be raising my hand or this note card when I need to interrupt for clarification. And that basically means I need a pause, and that allows me to perform at my best. Thank you. And you giving me a pause, this is another script, helps me interpret more precisely. Thank you for partnering with me. And this is just what Kudo uses on their platform for remote simultaneous interpreters to remind the speakers that they need to slow down. And the pace at which I'm speaking right now, I'm sure, is over 120 minutes because I have a good amount of content that I want to share with you. But right now, if I was on Kudo, I might be in the orange or the red, and that would be a reminder to slow down. But I will admit that it's not perfect. Any of these signs and even these requests don't always work perfectly. Like most things, we just still need to push for them. But people don't often or aren't often capable of following everything that we need. But again, just wanting to establish good expectations, but we should always ask them. And people, if they get to partner with you more often, or if they're working with you on a platform like Kudo, they may get used to it. It takes some time. So these are some stressors. So we discussed how stress is a big part of fatigue. And so these are some of my strategies for mitigating some of those stressors. The first one is the physiological sigh. It's a breathing exercise that involves 2 quick inhales through the nose, followed by a longer exhale through the mouth. It's a simple technique that helps you relax and reduce a certain amount of stress that's either mental stress or physical tension. And the first time I heard about this was from Ludmila Golovin. She does a wide variety of presentations on vicarious trauma in addition to other subjects. And she's shared this before, and it's a wonderful technique to do even in the encounter. And now that we are wearing masks, we still are wearing them where I work, or in most places it's optional, but many people still wear them. I do. It's wonderful because it's covering my mouth, and I can do these little sighs without anybody necessarily seeing a strange look on my face while I'm inhaling or exhaling. But it does help reduce stress, which, as we discussed earlier, could potentially improve our gas tank. And there's a link at the end in my reference on how to do this by another neuroscientist, or by a neuroscientist. And the links to Ludmila Golovin are also on the reference list. The second one is second victim. It's good to know what this is because I think it plays a part in us preparing better. The concept of second victim in healthcare is, it describes a person who's basically made an error. So in healthcare, the first victim of a mistake is the patient. They're the first victim. They've suffered the mistake. Either it was a wrong medication, wrong dose, wrong site operation. They're horrendous things to learn about. And it's also, if you've known anyone that's ever had a mistake happen. But the second victim is the person that caused it. So either the provider, the surgeon, the nurse, they've unintentionally made a mistake and they suffer the guilt afterwards. So they're a second victim. I would argue that for the interpreter, we can end up being a second victim when we've made a mistake in our interpretation, or we worry that we've made a mistake. The guilt and the concern can create stress, and that stress can drain our mental gas tank. So it's important to understand this because we can do better to prevent it by trying more techniques to do better with long interpretations or demanding interpretations. Either get better with our note-taking, get better with our symbols, learn shorthand, or find ways to have a more effective short-term memory. But on that note, another technique to help you to prevent mistakes or prevent either omitting or adding or changing would be the last first technique. So that's number 9. And the last first technique is something I use daily. And it's essentially saying the last part of an utterance first, especially when it's been a long utterance. And they have seen that in short-term memory, the most common part that you're going to miss is the last part. And we certainly struggle also with numbers. We get those wrong. Proper name. Last part of a long utterance is most likely to be missed, more so than any other part. So if you say it first, that will make it more likely that you will prevent an error, prevent missing it, and certainly prevent the worry or the guilt and the second victim stress, and therefore more fatigue. And to give you an example, so I've got a few that I've saved over the years. Okay, so here's one that a doctor might say. Okay, so we want to do peritoneal dialysis the day before the surgery, which is next Tuesday, I believe, and that way we can optimize our electrolytes. So instead of saying in that order, you might be thinking, oh gosh, we want to optimize her electrolytes and start there. So we'll do the peritoneal dialysis the day before the surgery, which is next Tuesday, I believe. So you've switched the order, you haven't changed the meaning, and you've also prevented an error and prevented the worry and prevented the potential loss of your mental gas tank. Another example of last first would be, here's another something I've heard over the years and saved it. So this is something from again, another doctor. Doctors and providers are the ones that generally talk the longest. So they are the ones that are the hardest for me. Okay, so she'll remain on anticoagulation therapy until her next stage of palliative surgery, even though we're glad to see by way of the scans that her clots are improving. I might flip it and start with, even though we've seen that her clots are improving, she'll remain on anticoagulation therapy until her next stage of palliative surgery. And we're glad. You I don't know if you noticed, but I said the last part first. So I would definitely recommend trying it. I do have one particular colleague I know who also uses this technique, and it helps her tremendously. And this last one, to mitigate the stress, which again is to prevent what could empty your gas tank even further and degrade your performance, is to not go down the rabbit hole. When somebody judges you or scrutinizes your interpretation during the encounter, you can say, I stand by my decision. I stand by my interpretation. For example, if somebody, and this happens with Spanish, I don't know with your language pairs, but it will happen with us with Spanish, where someone knows enough Spanish to hear a word and they pull it out and they say, no, that's not what that means. And they don't know enough about Spanish and they scrutinize you. And so what you can do, if you're sure you are correct, and maybe it wasn't perfect, but it was correct, or it wasn't wrong, you can just very calmly respond and say, I stand by my interpretation. Thank you. Don't go down the rabbit hole. And I've done it. It's one of the reasons why I don't recommend it. And you're right there in front of the patient or in front of the student and the parents. It's better to just cut it off or cut them off at the pass by just saying, I stand by my decision, or I stand by my interpretation. And it will save you gas tank, or save your gas tank, or save you gas in your mental gas tank. And then these are strategies to use during the encounter as well. So the chair, I have a chair. This was my previous chair, and that's a picture of me from a little over 10 years ago with that chair. I now have a different chair that's a little lighter and a little smaller, and I take it with me wherever I go. Most of my colleagues at the campus that I work at also use a chair. They bring their own. But I would say if we advocate for having a place to sit or bringing our own chair, that helps tremendously with your performance. And a script would be, I interpret more accurately when I'm sitting, thank you. Or I'll be right back. I need to go get a chair. Say you didn't bring it with you and you need to go get one. Say thank you. And you can do that in the beginning of the assignment, and you can stop the assignment when there's a pause in the middle and say, excuse me, and the interpreter is speaking. Hey, this is Andrea. I'll be right back. I need to go get a chair. I think that will help my performance. Another script that I've used is to explain, if I'm sitting, the patient doesn't have to strain her neck to look up at me. Thank you. And that is true. Many of our parents, patients are short statured, and they're many times sitting. And so if I'm standing there with my height, it can be a stressor. And then repositioning, I don't know if you know, I'm sure you do, Elena Langdon from Masterword, she calls this the roving interpreter, and I love it. But I do rove about, I roam about in the room. I change my position when I need to. And the script for that would be, excuse me, hey, it's Andrea. I need to change position so that I can sit next to mom. That way I'll be able to hear her. Or if you don't mind, I need to swap chairs with you for this care conference. That will allow me to sit next to mom and dad. And that way I can hear them better, or they can hear me better. Wherever you need to sit. And yesterday, in fact, I did this. I was sitting on one side of the room next to mom and a family member. The child was on the table, and the doctor was trying to talk to the child, but the child was very shy and not fluent yet in English, a recently arrived family, and they were looking at me. And so I had to change my position at one point and let everybody know I'm going to move over here next to the doctor to see if we can get more alignment with the patient and the doctor. And it worked really well. So I just sort of roved about and it works really well. I highly recommend it. Whenever you need to move, move. with a chair, it's very easy to do as well. And then also the idea of stepping away, if you need to, just step away when things get either too saturated, you become very fatigued, and you need a moment, just say, listen, you can prepare them in advance by telling them you're going to be stepping away as needed to protect your performance for bathroom breaks. Just focus on your primary task. Your duty to be accurate supersedes the ideal image of not stepping away or interrupting. And I would definitely recommend saying you need to go to the restroom. Over the years, I've tried different ways to step out if I need to, if I'm hitting saturation and I'm worried that I'm making mistakes. And asking for water has never worked for me because they'll say, oh, Andrea, you could just stay. You keep interpreting and I'll get you the water. And invariably they get me the water and I'm still interpreting and I'm very worried about my performance and I'm worried I'm making mistakes because things have gone on too long and it's been very demanding. So my most successful strategy has been to say, listen, I need to step out or I need a restroom break. Thank you. And like I've mentioned, prepare them in advance. I'll be taking restroom breaks. This will be long and that will allow me to go to the restroom. This will also be beneficial for mom and dad who most likely need to go to the restroom too, or take a mental break from all of this teaching. But I highly recommend that. And I definitely would say that a restroom break is more effective than a water break. But you can, some of the scripts would be, hey, this is Andrea. I need to pause, or I need a moment to step out. Thank you. Or I need to step out into the hallway. Thank you. I need a restroom break. Thank you. And this is I'm just going to speak briefly about this, but I have done a presentation on this before. And it's just the concept of using simultaneous combined with consecutive when you're interpreting for the sake of not just efficiency and a better outcome, like a more successful interaction, but also for mental fatigue. So you might switch from consecutive to simultaneous because of a sudden emotional outburst or a sustained utterance, which, like I mentioned, is generally our providers. They have a lot to share. But you may also switch to simultaneous because you're aware that the demands of the interaction are surpassing your short-term memory. Like a care conference or an IEP where there's been sustained and long utterance for a very long time, or demanding encounters with insufficient pauses. Tell them, hey, this is Andrea, I'm gonna switch to whisper interpreting instead of the back and forth tennis match. And that will allow me to perform better. Thank you. That's one script. And if you know the content well and you know you have the skills for simultaneous and the auditory nature of the environment allows you to do it, it will be very amenable for you to go back and forth between simultaneous and consecutive. So if you're in simultaneous, but you don't hear something perfectly or you missed a piece, then you can stop everything and let them know that you need to clarify and then go back into simul or switch into consecutive, whatever you need to make sure that it's the most successful interaction and that you perform at your best. And one script might be, hey, this is Andrea. I will produce a better quality interpretation if I interpret in a whisper at this point at the same time you're talking. Or when you see my hand go up like this, that means I need you to actually stop so I can clarify and make sure that I'm doing the most effective interpretation possible. So it's a combination of simultaneous and consecutive. And here's some of the equipment. Many of you probably use this. I was recently speaking to our manager, and we are looking at this potentially for some of our events, for our families, commemorative events, for grief-related events. And we may end up using something like this again to help with the auditory nature of multiple people in a room needing an interpreter. But even in small encounters, I recommend that this be used if it's something that you can do. And if it's going to be a unilateral type of teaching or a dynamic where someone's doing most of the talking and there's only a little bit of dialogue. But you can, again, same thing, you've got the auditory benefit of the technology so that you can hear everything. And then the people who are hearing you can hear you quite well because of the equipment. But it also allows you to stop everything and go right back into consecutive for the sake of safety, for the sake of accuracy. So you're using it in a bit of a hybrid way, as opposed to maybe another environment where, like if you're doing simultaneous in a conference setting, some of those opportunities to interact or engage are not there. But in healthcare, it's not only our right to interrupt or engage, but it's our responsibility to make sure everything's clear. So you can do both. It's a bit of a hybrid. And then this one is for interpreters and managers and trainers. If you can rely on your team, or as a manager, if you can encourage your team to rely on each other and switch out with each other as needed and as possible with your operations or your daily operations or the way your team works and what's happening, I highly recommend it. If you can share the workload, especially with tough cases, do it. We do this on my team. I'm very proud to say we're a very, very cohesive team. We care tremendously about our families and our providers and making sure we get it right. So we do share the workload and supplement it. My management's very good at this. And I don't know if you know Carla Fulgarin, but she shared once on a panel that she supplements or had supplemented in a particular instance when an interpreter of hers, like one of her staff interpreters, was going to be dealing with a very stressful encounter and chose to supplement it with one of our vendor colleagues and said, let's just go ahead and use the vendor OPI or VRI. And we do that as well. Sometimes there's just no way for us to do it all or to keep going when we've hit a point of saturation and we're no longer performing at our best. So this is really for everybody. Team it, share it, or supplement it, or all three. And then post IMI strategies or after the encounter, again, acute physical exercise can provide you with additional brain fuel, or at the very least, remove that sense of your brain being like scrambled eggs or feeling like toast. It really does help tremendously. Again, just a short burst, 3 or 5 minutes. You can do, depending on your mobility, jumping jacks in the bathroom. If you have a gym where you work, we do. It can help you too. Just a few minutes after a care conference, after a 3-hour diabetes class, whatever it is you need. It improves cognition. The research shows this, short-term memory, and relieves any kind of anticipated stress. So like we've mentioned before, or I mentioned before, you could do it beforehand, but this also works afterwards, because you can do it afterwards to get a little bit of gas tank, a little bit of your gas tank back, and then it will help you on your next assignment. And then know thyself, again, write it, track it, reflect on it. What did you excel at in that assignment? What was what was frustrating? What was stressful? What was boring or annoying? Those are also depleters, or they take from your gas tank. And just reflect on it for the sake of your performance in the future. Next time you'll be able to say, okay, wow, this is not my favorite area. I'm not very good at it, or I don't really enjoy it, or it's highly stressful or triggering. So you'll know if you do get that kind of assignment that you might really use some extra interventions, especially breaks, to say, listen, I'll be taking a break on the hour every hour just to protect my performance. Thank you. And I wish there was time to share the things that I like and don't like, but it's really useful to know it. It just kind of gives you a better sense of how the day is going to be. But with this last one, green is good. I think it's really important for us to think about the research that they've done on green space. So they've done research on green space. The Kaplans and Hardig in one study asked participants to complete a 40-minute sequence of tasks designed to exhaust their directed attention capacity. And in plain language, that basically means they were charged with doing tasks that depleted their gas tank. And after that, they were randomly assigned to a 40-minute break. One group was assigned to walking in an urban or city area. Another group was assigned to sitting quietly while reading magazines and listening to music. And the third group was assigned walking through a local nature preserve, or basically green space. And after that 40-minute break, in those 3 groups, the ones who walked through the green space or nature preserve performed better than the other participants on a standard proofreading task. They also reported positive emotions and less anger. So it's a very useful technique for refilling your gas tank. But what if you don't have green space? We don't have a whole lot of it where I work now, but in September, we're about ready to move to a new facility and there's a lot of green space there. But what if you don't have it, or you don't have the time to go outside to get it? I would recommend virtual reality goggles and downloading an app that's got a lot of nature scenes in it. This is a wonderful thing that we could do for ourselves individually to keep with us, maybe in our our backpack or a briefcase, or to have it in the office in an environment where you have a team. One way to just release some of that stress when you don't have the green space to actually go to physically. Some of the virtual reality apps out there are just phenomenal. And this is what I've done for, I probably did this for about 20 years with new hires that were clinical, where I tried to prove to them, and this is very much something for interpreters, managers, and trainers, is to try to prove to people how complex this job is in dialogue interpreting, and that memory or memorization is no easy task. And I'm happy to share this with anyone who wants it, but what you do is when you're working with a new group of employees or leaders and say, well, I just want to see if anyone wants to come up here and be a volunteer, anyone who's a bit of a ham, who doesn't mind showing or proving something for me, which is essentially proving short-term memory. And you get someone to come up front, definitely offer them a gift for doing it, since they're willing to make a fool of themselves in front of a bunch of people. And I've done this with managers. And you have them come up to the front and you say, listen, I'm just going to have you help out with landing a small aircraft. All you have to do is repeat what I say to all these people out here in the audience. We're all trying to land a small aircraft because the pilot just passed out and we need to land it. And all you do is just say this first chunk, which is only 3 sentences, and then have them repeat it. And then everybody laughs because they don't get it right. They barely get any of it. And they're all very short words. These are not complicated foreign words. And then the second paragraph, go ahead and say it and have them repeat it. And of course, they'll really struggle. They'll probably get half of it wrong, some of it right, but only part of it. And, you know, just just to give you a sense of my cadence when I'm saying it, I'll be like, okay, we're on a radio here. On your final approach, try not to get a bit too high. And okay, now turn off the power with full flaps, aim straight at the tarmac and come down steep to keep the speed fine. And then wait and see what they say. And it's really quite fun. A lot of people find it fun for sure, but I've had people come up to me over the years and say, I never knew that interpreters had to have memory. I never realized that's what you were doing. I just thought you were just nice and you spoke Spanish. And it changes their understanding and their way of valuing us, to at least see this as one more skill that we have. We have a lot more skills than that, but that is one that I think is really useful. And this is a fun way to prove it to them. So you're welcome to have that. Just you can reach out to me and I can share that with you. But just in conclusion, we need time to be able to do these things. We need to make the time. Instead of asking for the time, you can make it and then say thank you. You know, say whatever it is you need in that encounter before the encounter, make the time to ask for what you need. And we need the trust and we need the rapport of other people, but we also need to trust that we know what we need as interpreters. And with value, this very much has to do with us valuing ourselves and our skill set. And we show it to others and we prove it to others by asking for what we need every time we ask for it, even if we don't get it. Every time you ask for it, you're teaching them. And this is something that I argue, it's something I spent years feeling. I always felt guilty, or I felt like I wasn't the best interpreter if I had to clarify, if I didn't know a word, if I didn't understand something, or if I missed an entire sentence. And I would feel guilty for interacting or interrupting. And I certainly don't want to, but when I have to, for the sake of good performance, or when I have to ask for the things that I need, I do it because I feel accountable. And that has helped me. It's a change in mindset. I just feel like I'm gonna intervene and interrupt as much as I need to for the sake of this family getting what they need and for the sake of this provider giving what they came to this job to do. So that's a really helpful way to think about it. Don't feel guilty, feel accountable.
Wow, that was excellent. Thank you so much, Andrea Henry. You can hear me okay?
Yes.
No, thank you for that. We have actually a million questions. I don't think
Okay.
a lot of really excellent questions in the Q&A, in the chat. I think it was really, really comprehensive. One of the things that that definitely comes to mind as I hear you speak, you have so much experience and you've been in a ton of different environments. What would you say to the 20-something interpreter or the new interpreter that is getting into the field? is I certainly feel like even advocating for yourself or finding the way tact in the right situation is almost like a skill you have to develop as well.
Yeah.
I
Yeah.
would love to hear how you think about that. Let's say if you were going to start interpreting for the first time.
Yeah. Yeah. And you're right. A lot of this takes time. We don't get better at this work without reflecting on it, and we don't reflect on anything that we haven't done. So we have to do it to reflect on it. But my suggestion to all of my new colleagues who are starting in this field, and bravo if you're on this webinar already as a new interpreter, but to find a mentor, find someone that will listen to you and be your sounding board. Am I saying that right?
Sounding board.
Sounding board. Someone who will listen to you and give you that confidence to say, no, you can ask for that. Do this. Try this. And somebody who's very practical, someone who knows that even though you ask, you're not going to always get it. But we need to ask. But I would say first and foremost, find a mentor. And secondly, don't let perfection be the enemy of good. Do your best and walk out and reflect on it and think, okay, next time, what could I ask for to make this better? And to hold on to that final mindset that I shared, don't feel guilty, just feel accountable. And you can use that word in your scripting. You can say, listen, I am responsible for doing a very good job here. And every time I interrupt you, that is why I'm interrupting you. I want to do a good job. And the minute you say, I want to do a good job, especially when you're new, people just sort of like relax and they go, oh, okay. Because when you interrupt people, they don't often know if they're the ones at fault. So you kind of, again, empathy helps very much, because sometimes I've experienced that sense where somebody gets a little irritated. And then I realize later, I think they felt sort of like they had done something wrong. And that's why I asked them to repeat it or to say it in another way. So I think, find a mentor. Don't let perfection be the enemy of good. Have some empathy for them and do whatever you can in the way you speak to be normal, instead of saying, this is the interpreter needs to clarify. That sounds really weird. It's not very human. It's not very normal. But if you say, hey, it's Andrea, I need a little help here. Can you say that again? Just be normal, and say that to the parents too. I regularly say, thank you so much to the parents. That helps me understand better. Now I can say this to the doctors accurately. And it just lowers the stress level of everybody. But find a
Wonderful.
mentor.
Absolutely. Find a mentor. As a follow-up to that, because I notice you bring so much of your personality, and even just saying thank you so much to the parent, I think of the term, just a quick candid, thank you so much, and then explaining it to the doctor. Do you interpret that? I always immediately, I think, how does that impact communicative
Yeah.
autonomy? Am I violating transparency?
Yeah. Yeah. I think, the goal with transparency is to make sure that everything is said to both sides. I think some people can get pretty dogmatic or rigid about it. I don't think that we achieve a lot when we're very dogmatic or very rigid. So I think you can kind of be a little practical about it and just make sure each side knows what you're doing.
Yep.
And that's the goal of transparency. And I think that also creates that trust that, oh, Andrea asked that, and she let me know she asked the doctor. And I usually in that process will say something like to the family, oh, I just, Andrea's the interpreter. I just asked the doctor if he could explain to us what vasculature is. Oh, thank you. And I also so I make sure that they know what I did, but I also kind of remind them that I'm part of this and I'm not any better than they are. I may know what the word is, but I don't want them to think that I don't think that they know it. But I know nobody knows that word. Nobody in English knows the word, but you'd be amazed at how many doctors might use that word because it's part of their language. It's the silo that they're in. And so I do think that, yeah, we just have to be transparent, but we also have to be quite practical about it.
Absolutely. Absolutely. On the equipment you guys were using or contemplating using, how are you working through selecting the right equipment for your specific scenarios?
Oh, that part I don't know. My manager, I mentioned it because I have the equipment. I just haven't used it at work because I'm waiting to see what we're going to do with different environments. But there's very inexpensive equipment that you can buy just with a small set if you only have a few people. That part we haven't really gotten to in terms of the equipment for improving the auditory nature of simultaneous interpreting, which I believe when I was talking to my manager that she's just looking at how we can help with some of the the grief ceremonies that we have for families. And there's usually multiple families there, and so it can be really disruptive to have an interpreter doing shukatage or whisper interpreting, and so the equipment would help with that as well. It would help the
Okay.
interpreter's performance and help the audience from not having to hear a second voice.
What's the brand? If you happen to know.
The one that I bought, I don't know it off the top of my head. I got it on Amazon. It was
Got
super reasonable.
Okay. Excellent.
Yeah,
Excellent.
I
Just
could
just
send
a
it to
quick
you.
Absolutely. Yeah, no, we can include it. Just a quick housekeeping item for everyone. We are at the hour mark. We're going to try and get through maybe a few more questions as long as Andrea has some time.
Sure.
But you are free to go. You will get your certificate for your CEUs within 24 hours. It will go to the email address you used to register for the webinar. Okay. Let's see. So someone did ask, what else? Can you talk a little bit about, you used the term at the beginning, normative ethics.
Hmm.
Can you talk a little bit about that, how that relates to the interpreting profession?
Yes, so Dr. Robin Dean, like I mentioned, she's in the sign language interpreting field. She's a researcher, trainer, interpreter, but she talks about it a lot in the publications she's done and in the teaching she's done. But normative ethics looks at things through the lens of context and consequences. So you make decisions based on the context, which always changes with people. So we're interpreting for people, and people by their very nature may have very different needs at different points, even in the same dynamic, same group of people. Things change from day to day. But it's the concept that instead of looking at the code of ethics like a set of rules or, like do this, don't do this, something very prescriptive, it's more geared towards looking at your code of ethics through the lens of, okay, so what is the context? Who are the players? What's happening in this moment? What would be the best decision for me in terms of either intervening, the best way to capture the meaning of what's being said, and what are the consequences of what I do? If I don't do it, what are the consequences? If I do it, what are the consequences? And that is the same set of ethical parameters, or the same kind of ways that doctors, nurses, any provider in a healthcare setting, that's how they're making their decisions as well. So her argument is we should be looking at our decisions through that lens, that we have to make the decisions based on the context in that moment and the perceived consequences, not on a very dogmatic view of the code of ethics, I think, says I'm not allowed to do that, or that that's illegal, or don't do that. Those are my words. Because I've met many people that say things like, oh my gosh, you can't do that. And so we've had a problem in the field, and I would definitely agree with the idea that we're not making decisions enough based on normative ethics. And Dr. Dean argues that we should, and I would agree wholeheartedly. But you can Google it, but it's also on my reference list. There's a nice little link on the reference list that I can share that does explain what it is.
Okay. No, wonderful. So you will be sharing your slides and it'll be listed there, or you'll at least be sharing the reference
I'll
list.
share the reference list. Yeah.
Perfect. Perfect. Okay. And let's see. So I love the points you're making about ultimately it's not about being rigid or legalistic. It's ultimately about having agency within the encounter to drive these outcomes and using these codes of ethics as something that gives us more empowerment, if you will. Not thinking of them as rigid, sort of dogmatic, black and white. There's always gray, there's always nuanced situations. So bringing our humanity, our critical thinking to every situation. We did have a question from Andrea, not from Andrea, from Maria. I'm going to go ahead and read it out. And it's along these lines. Sometimes I have noticed with new interpreters is that they stick 100% to our code of ethics, which is great circumstances, but a lot of encounters require us to adapt and make a lot of decisions when it comes to interpreting that do not always align with what we are taught. Are there any resources related to this on how interpreters can enhance their experience outside of this webinar?
Yes. those links that will be on the reference list are really useful. And I would recommend that, like, if you've just done a 40-hour class, and most of us have in the beginning, at this point, I don't even know where my continuing education total is, but it's probably close to 300 hours just because I'm a total geek. And I've watched all of the CCC ones. I absolutely love continuing education, but most of us in the beginning of our career, we think, oh, wow, those 40 hours or the 60 hours maybe, or maybe you've
It's
done
not
the
enough.
full year with Kaiser Permanente's curriculum. It's still not enough for us to know everything. But if you look at a nurse, they're also dealing with the very same thing. They've done their schooling a
Mhm.
lot longer than what we do, and they come out and they're new grads and they struggle. They're trying to figure out how to make decisions, and they're doing it through the lens of normative ethics and a wide group of colleagues that are helping them. As interpreters, we're alone. We're almost always like totally working on our own. Maybe we have colleagues, but maybe we don't ask, or maybe they don't know, or maybe they are those rigid folks that say, oh God, no, you're not allowed to do that. Even though most people that say that I have noticed haven't really looked at their code of ethics. They'll say, oh, that's not ethical. But I think, oh my goodness, I don't know what they're talking about. That doesn't say anywhere in any of our code of ethics that's inappropriate. So we get the wrong idea, and it's pretty human. I certainly was in that same phase myself at one point. So I don't judge, because I was there as well. I think if we could read more and watch more presentations by people that have been researching this.
Mm.
The people that are doing our training initially, they're giving us the primer, but we really are charged at that point with growing. So I would recommend looking up Dr. Robin Dean's work, which some of it's on my reference list. Anytime she's presenting, watch it. Also, Robert Lee and Llewellyn Jones, they're the author of Role Space, which is another wonderful way to look at your code of ethics through that lens. And then he has they have a book that you can get, and so does Dr. Dean and Robert Pollard. Anything by Elizabeth Cecilius, I hope I'm saying her name right. Dr. Rachel Herring. We have a lot of really wonderful, very knowledgeable people out there. I think we just need to keep growing. I think that initial training is meant to get us started, and we start off with a straitjacket, and we need to get better, because the parents or the patients are not getting the best interpreter when they're getting someone who is so dogmatic that they've actually potentially done something quite unethical. Ironically, in their goal to be ethical, they've maybe done something or chosen not to act or take action even when something should have been done. But again, I can't judge, because I was there myself. For many
Absolutely.
years, I think I was stuck in a bit of a silo.
Absolutely. Absolutely. Thank you for that. Okay, so this will be probably our last question. Just a reminder, you don't have to hang out. We're just going through a few of the questions. Everyone will get their CEU within 24 hours. Feedback. So you talked about you have to do something in order to be able to reflect on it. You have to be able to reflect on it in order to get better on it. But that's our own sort of perspective on what happened. How do you work on maybe doing a more comprehensive, more feedback, getting feedback, analysis of what of how you performed and how it actually impacted the interpreting encounter?
I hope I understood the question, but how do I grow through getting the,
No,
like, how do I get the feedback, or how do I reflect?
no, and I'm sorry that wasn't clear, but how do you think
Okay.
about getting feedback um, or do you work on getting feedback from folks?
Yes. Yes. Okay, I got it. Yes. Oh, I love feedback, bad and good. All the awful mistakes I've made over the years were fabulous teachers. And then when I've gotten feedback from people, good and bad, it helped me tremendously. So I ask for it now. And that I work with a group of interpreters who shout out to the Eggleston team and to the entire system management. We have an amazing team of interpreters at Children's Healthcare of Atlanta. But we come back into the office, and the first thing we do is look for feedback. I'm like, okay, how do you say this? She just said, like, elevated sideline position. What on earth? Like, like I tried to come up with something in the moment
Yeah.
based on what it looked like, but I was lost. I'll come back to the office and ask for that kind of feedback on the technical aspect of our job. Many of us come back to the office asking, like, I did this in the moment. I asked for clarification on this, and this is what happened. What would you have done? And so we do a lot of that reflective kind of process amongst ourselves. But I personally will ask when I walk out of the room or before I leave, I'll let a family know that I'm very appreciative of having interpreted for them. That's one of my scripts when I leave a room. Thank you for letting me interpret for you. It was a pleasure. Please put us to work. But I also ask families when I do, mostly when I do simulsecutive, I'll ask them before I get started what the family dynamic is, so I know who speaks English and who speaks Spanish, because simulsecutive will work well for some instances. But at the end, based on what I did, I'll ask them, how did that work for you? The next time I work with you, we do have a bit of a privilege where I work in that we get to see the same families over and over and over and over and over again for years, sometimes decades. There is a few families that I've known for close to 2 decades. And so you get to learn what they like, and they get to trust you. And it's always hard for me to know if they're really telling me what they want. So I try very hard to be open and say, do you like this or do you like this? Because I like doing both, but which one did you like? As opposed to saying, what I did you like it? You get a very different answer with that. So I try to keep it open and get their feedback with that practice. And with doctors too. We work in a teaching environment, so there's a lot of groups. So when I step out of the room, I might let people know why I did something. And then it kind of gather a little bit of their impression on it. And sometimes I get really good feedback. One of the doctors I worked with in the clinic, who I was doing a lot of simultaneous for with teenagers and their parents, just randomly told me his feedback, that it was amazing for him. And it gave me a sense of, okay, this can work. Not all providers want the same things. And not all families do, but I love getting the feedback if it's unsolicited. And sometimes I do ask, I'll say, I want the feedback, good and bad. What could I do better to make this smoother? I know I interrupted you a lot. I apologize, but I wanted to do a good job. And I wanted to make sure things were clear. And I'm always trying to elicit it. So I encourage people to do that, but it takes time. I didn't used to do that. I didn't have the confidence to do it. So it does take time. But I think asking for it is great to do in the beginning of your career if you can, if you've got the confidence, because then you will probably gather a lot more knowledge a lot faster than I did.
A lot more feedback. Yeah, and I think it almost imparts to the other members in the encounter that you're just not this rigid tool. You're a human being that wants to partner with them to drive the best outcome possible.
Yes.
That you have humanity, you have common sense, and you have goodwill, and you're part of the
Yes.
team, and you want to learn. No, so absolutely.
Yes, and that does set us apart from AI. So it's like
Absolutely.
interesting. I'm like, okay, I'm interrupting a lot here, but we're achieving a really successful interaction. And I hope that they see that having a human interpreter, whether or not it's by phone or by video or in person, is going to be ideal. And because we're able to capture meaning, and we're able to understand the words within the context. It's not word for word. And AI is still not it's not safe enough for a healthcare environment.
Yeah, if ever.
Exactly.
Okay, so last question. What are 2 or 3 resources you would recommend to an interpreter? Trainings, books, things. Let's say you just finished your 40-hour course, maybe even been interpreting for a year. What really set you on your path to thinking of interpreting as a craft and really, really improving?
To look at yourself as a practitioner and to not allow people to use you as a machine. So here's a mindset more so than the materials or a book, but to think about yourself much in the way Dr. Robin Dean writes about and teaches about, that you're not just a professional. So it's one step above occupation. We are a profession. We're not an occupation. It does require incredible skill set and critical thinking. But in addition, we're a practice profession. So think about yourself that way. And that's one way to get started. But like I said, any of the materials that are on my reference list would be my suggestion. But I would say come to work at Children's Healthcare of Atlanta so that you can work with a bunch of practitioners and work with people that really, really believe that within our parameters of our ethics, and by informing those with normative ethics and with all the research and literature that's out there by Robin Dean, Robert Pollard, Lee and Llewellyn Jones, all the people that I've mentioned, that you can do this job and actually make a real impact on a family's life by making that communication meaningful and not just words.
Absolutely. Well,
Yeah. Did I
wonderful.
answer that question? I feel like you asked for
I
something.
think you
and
did.
just
I
did
think
I?
you
Okay.
did. No, no, absolutely. Sure did. Absolutely. Checking in, asking for feedback. Absolutely. No, I think it makes perfect sense. Thank you. Thank you, Andrea, for taking time out to present to us. I know I learned a lot, judging on all the comments. Everyone loved the presentation. You'll be sharing your list of resources.
Yes.
Okay, everyone. Well, thank you so much. We're going to go ahead and shut down the webinar. Have a good day, everyone. Thank you,
Ciao.
Andrea.
Thank you,
Bye.
John.